Today's presentation will feature Dr. Aileen Antonio, a neuro-ophthalmologist with the Mercy Health Hauenstein Neuroscience Center in Grand Rapids. She is also an associate professor of neurology and ophthalmology at Michigan State University. Dr. Antonio has a rare and very extensive educational background, including a medical degree from the University of the Philippines College of Medicine, followed by an ophthalmology residency at Philippine General Hospital. She then completed a total of 5 years of neuro-ophthalmology fellowship, followed by an additional residency in neurology at Michigan State University. She has truly dedicated her life to becoming a nationally regarded expert in neuro-ophthalmology, and in addition, she is a leader within the American Academy of Neurology in the area of advocacy, and as the current national vice chair of the Academy's Neuro-Ophthalmology and Neuro-Otology section. Dr. Antonio's patients treasure her. She has said, "I spend a lot of time listening to my patients and to try to get to know them beyond the medical issues that brought them to see me. I believe in having an open communication between us." Of course, with the drastic changes in our world over the last several months, the way that many of us communicate with our medical providers has changed. So it is our pleasure to introduce Dr. Antonio to update us on some of those changes and how technology can be utilized to enhance the care experience for patients living with myasthenia gravis.
Hello, I'm Dr. Aileen Antonio, a neuro-ophthalmologist at the Mercy Health St. Mary's in Grand Rapids. Thank you to the Myasthenia Gravis Foundation of Michigan for inviting me to talk to you today. I hope that everyone is doing well and enjoying the conference so far, despite us not being face-to-face. I'm sure you miss seeing your friends and would have loved to hug those people who have supported you in your journey in myasthenia gravis. But being on this virtual platform, I bet, is still a big help to all of you. With most of things being done virtually nowadays, isn't it just perfect that I'm here to talk to you about telemedicine for myasthenia gravis? In this talk, I will be using terms telemedicine and telehealth interchangeably. In telehealth, we use telecommunications technology to evaluate, diagnose, and care for patients at a distance. Through telemedicine, we can deliver remote patient care through two-way interactive communication between you and your physician and even other providers. These can be synchronous through a video conference call. So the synchronous means that there's audio and video together at the same time. Or asynchronous, wherein it's usually audio only, like through a telephone call, or you can send messages or photos or videos that you took, and then we will exchange them over the patient portal or through a secure messaging platform that your doctor's institution has, and then we'll reply after that. Due to the social distancing mandates to prevent COVID-19 transmission, the Centers for Medicare and Medicaid Services, or CMS, and private insurance expanded benefits of telehealth coverage so that you can stay at home, decrease the risk of COVID-19 transmission, and still get the medical care you need. Most of us neurologists, neuro-ophthalmologists, and even your neuromuscular specialists were able to adopt telehealth encounters into our practice. By now, some of you may have seen your doctor through this virtual platform. Some of you may even think that telehealth encounters are suboptimal compared to seeing your doctor face-to-face. For those of you who are still hesitant in doing telehealth consultation with your physician, let me reassure you that we screen the patients who may be adequately evaluated through the video encounter. We realize that not every medical situation is right for a virtual visit. If we feel that it will be inadequate to evaluate you through this platform, then we will definitely have you come in and see us in the clinic. If during the telehealth encounter, we come across an issue that needs to be addressed face-to-face, we will accommodate a follow-up visit in the clinic for that too. We have done video visits even for new patients, so those who have not seen the doctor for that particular condition. And with some of my established patients, telephone visits may be done for follow-ups, and I use these telephone encounters commonly to discuss the results of workup, or if I'm monitoring particular medication titrations like the prednisone that you have for the myasthenia, or even the mestinon. We also use that to discuss the next steps in management, and you can discuss with us any of your questions or concerns as well. And as I mentioned earlier, you can also use portal messaging or e-refills that are being sent from your pharmacy as a way to use the telehealth or telemedicine route. There are numerous benefits to telemedicine encounters. It is, number one, time saving. You can schedule your appointment during your lunch break, before or after work. You can do it anywhere in your office, but make sure that it is affording you some privacy. You don't want others to hear about your medical information. And of course, you also don't need to worry about finding a babysitter or someone to stay at home with your elders. You don't even have to worry about the logistics of bringing them with you in your clinic visit. You can still take care of yourself and as well take care of the responsibilities that you have towards your own family. When you see your doctor on your mobile device or computer, you can save money on gas, parking, or public transportation, and you save that time traveling to the clinic and back. Patients who come into the clinic are carefully screened for possible COVID-19, but there is still a risk of possible COVID-19 exposure when you come in. With a video visit, the risk of catching something from another patient is eliminated. With telehealth encounters, we are also able to minimize the possible exposure of the clinical staff. So we benefit from this too. Having telemedicine encounters available, then you as a patient avoid potential visits to the urgent care or to the emergency room, thus further decreasing your exposure to and spread of COVID-19. When you are able to see us as often as you need, then you are on your way to better health. When the stay-at-home mandate was in place back in March, we continued to see patients via telemedicine. For the most part, telemedicine encounters for myasthenia gravis patients have been quite appropriate and very effective. We are able to continue and deliver medical care this way. And the last but not least of the benefits of telemedicine is access to specialists. In my case, I am one of the only 3 neuro-ophthalmologists for the entire West Michigan. At times, we even have patients traveling all the way from the Upper Peninsula or even from the Midland or Saginaw area. Having the ability to give medical care through telemedicine not only removes your travel time, but also brings us specialists to your homes in these distant and remote areas. Thus, you have that specialist care that you may usually see only in an urban or suburban setting. Despite all of these that I enumerated, I understand that some of you may still have concerns about telehealth. The primary one is likely the question of getting to the right diagnosis. As mentioned earlier, not every case is for a video visit. We assess each case and determine when it is safe and effective to conduct an evaluation using telemedicine. The second issue that usually comes up is a concern regarding privacy and security. Because of the pandemic, CMS waived patient privacy rules to encourage telehealth and promote continuity of care by using existing technology. In my hospital and in many other institutions, though, we use a telemedicine platform designed specifically to protect patient information, keep it secure, and meet the strict standards of the Health Insurance Portability and Accountability Act, or HIPAA. The next concern that you may have is likely insurance coverage. In Michigan, we are under the parity law. What that means is that private payers would cover the video visits on par as if you would have come into the clinic. This is important to take note of if your physician is out of state. So among the neighboring states to Michigan, some of them don't have this parity law. And those states are Illinois, Wisconsin, Ohio, and Pennsylvania. So if your physician is from one of these states, your doctor's office should verify eligibility for telemedicine. In other words, get prior authorization before your appointment. The policies around telemedicine are constantly changing. As providers, it is our job to be abreast of these changes. You can always call your insurance company before a telemedicine encounter to verify your coverage. That number should be on the back of your insurance card. And of course, the next question is, what if the call fails? You're in the midst of that consultation and then something happens, right? You get disconnected. We always try to reconnect with you, whether it's trying the video platform again or whether through a telephone conversation. I have learned to perform my evaluations, the exam portion first, so that if this happens, then that part is done and I am confident to just continue the rest of the visit through a telephone encounter. It's good to have the number of your doctor's clinic on hand during the visit so that if you don't hear from your doctor in a timely manner, then you can just call the clinic as well. So this brings me to the next topic. To avoid these technology issues, there are a few things you need to check before your appointment. Preview your webcam. Mac users can launch the photo booth, and then the Windows users can go to that Windows logo and click on camera, and then use that camera app even on your tablet or on your smartphone, and even launch a video call with a friend or a relative, and then that way you know that you're centered within that monitor. You know how to use the lighting in that room and make sure where you're seated, it's appropriate for you. The next thing that you need to do is test the microphone. Make sure you wear a headset that has a built-in microphone or even have an external microphone. The microphone included in laptops and computers do not transmit the sound well. And again, making sure through that video call that you test that you sound, that you transmit well is also good before your appointment with your doctor. Next would be checking your internet speeds. Because so many people are staying at home and using the internet at the same time, our bandwidth and service are slowing down in many neighborhoods and even in the same household. So you can visit speedtest.net to gauge your internet speed. If your speeds are below 20 megabits per second, there's a high likelihood your video is going to look pixelated and you may have audio delays. So for this next part, let me give you some tips on how to troubleshoot these slow wireless speeds. The distance between the router and your device can slow down your Wi-Fi connection. Make sure your modem is in a place that has access to circulating air and is away from anything that creates heat. When electronics get too hot, they will not work properly. It's like when I get hot in my head, that brain will not work properly. So find a place where the modem is elevated, like a bookcase or a shelf, to get you better coverage. Places that are centrally located are even better. Interference from physical obstructions can also slow down your Wi-Fi. Look out for brick walls, water, metal, reflective surfaces, windows, and furniture. So any kind of wall or door can cause some of your Wi-Fi signal to be lost or disrupted. You can try opening an inside door and maybe that flow will be better. Other electronics in your home can produce electromagnetic interference that can slow down your Wi-Fi connection. This can include microwaves, cordless phones, cell phones, Bluetooth devices. We have so many gizmos now in the house that there's so many that may potentially interfere. So you can make sure that they're turned off while you have your appointment, or even unplug some of them. So how do you make then the most of your visit with your doctor? So to prepare for the appointment, write any questions or concerns that you want to discuss. Make sure that you have an unupdated medication list on hand with a dose and the schedules, the times when you take your medications. That is very important. Charge your equipment beforehand. Videos can eat up your battery, and it may even be a good idea to keep your equipment plugged as you are talking to your doctor during that entire visit. Choose a quiet and private area. If you're at work, again, you will not want your coworkers to likely hear your medical story and your private information. Even if you're at home, you want to make sure that you or your doctor won't be disrupted or distracted by children or pets. And the simplest physical boundary is just by closing the door while you're on a video call. And on video calls, I make it a habit to point my webcam to a blank wall, away from common areas like the kitchen or a hallway. And please, the very important thing, no driving while you're on this virtual visit with your doctor. We need to keep you safe. I have rescheduled a patient's video encounter because I saw that as I was talking to her was just coming on the phone call that she was driving. So that's a big no-no. So do's and don'ts for video visits. Don't position your camera too low. So with this one, it gives you that awkward angle and then I can't see you. And it's very good to be able to see your face. Don't position it too high or too low like with this one either. And then what is important is that you keep that camera at eye level and you're centered on the monitor. And then that way, we can see you fully. And that's part of the examination that we do. When you hold on to your camera, to your phone, or to your tablet, any movement may be distracting to us. And then that would cause nausea and dizziness, as you can see from that video. And it's best to stabilize your equipment. You don't need really expensive ones. You can just make do with what you have at home and then prop it against something that's sturdy and even elevate it if you need it so that when you sit down or when you position yourself, you're sure that you're at eye level with that camera. Another thing that people usually do is that they think they're outside and it's bright and it's going to be good, but make sure that you don't sit against the light because again, that casts a shadow on your face and then we won't be able to see you. So make sure that your room is well lit and You can simply turn on the overhead light. Ambient light is good as well with side windows, or even a side light is potentially best. At times when, during that portion when I'm actually doing eye examinations and it's still dim, despite all of these maneuvers, I actually ask the patient to walk to the bathroom because the bathroom light is very bright and it's right in front of your face. So like what the setup I have here, so it really intensifies and I'm able to examine you very well. I also tell my patients, especially if you are seeing a neuro-ophthalmologist or a neurologist, have a flashlight on hand because we will want to test your pupils. If you are using a different device from your phone, so say you're on a laptop, a tablet, or a computer, then the flashlight on your phone would be appropriate. You can use that. And then the other thing that I also tell my patients is that make sure that you have enough space of around 4 to 6 feet for some parts of the examination. So be ready to be able to prop your phone against something at the leg level, because we will be examining your lower extremities and we will be asking you to walk. So as you can see on this next video, that's part of the neuro exam that you usually do when you're in the doctor's clinic. So, a very important tip for you guys. Please, and do this, please wear appropriate clothing. I have encountered some patients wherein, yes, we need to take a break and I have to tell them, put your phone down or turn away from the screen and put pants on. So please be appropriate with what you wear when you are talking to your doctor, and make sure you're presentable. And then I just want to show you other parts of the examination so you can see how effective telemedicine has been, even for a neuro-ophthalmologist, where these little things in your examination matter. So in this case, I'm testing her cranial nerves, and I explain every step of the way, and I even show her on the screen from my end what to do, so she kind of mimics me as well. And then with this one, I'm testing her eye movements, and this is just a small part of that eye examination. And this is the tricky part, actually, when you are using your own personal device, and the camera is off to the side, you kind of second guess how to center yourself on the monitor, but I will guide you so that I can see what I need to see. And then with this one, I'm instructing her to have her finger out and follow it with her eyes as I check if she has full eye movements. So she's looking up and then she's looking down. And in this part, her head doesn't have to move. But as she was looking off to the right, she kind of missed that instruction. So we redo. I just redirect and we do it over again. So again, these things that we do in the clinic, if you're face to face with me, so many things we can do via video as well. And finally, after we finish, the history taking and the examination part, your doctor will discuss the findings and go over the next steps and possibly therapeutic options. This is the time for you to raise any of your questions and concerns, and everything is up for discussion at this point. So make sure that you have a pen and paper on hand so that you can write down the stuff that were discussed, instructions, because unlike a clinic visit wherein as you check out, you're given a patient summary, you're told where to go for labs and all of that, then at least you've written those instructions down. If you are on the patient portal, like a MyChart, of the doctor's institution, then that will automatically go also to your portal. But it's always good to have a pen and paper in place. So if you have any questions or concerns, please send them through that chat in the bottom of your screen, or you can even email them to Myasthenia Gravis Foundation of Michigan, and we'll be happy to answer any of those and reply to you. I think they are planning something in the next few months, so watch out for that too. And then, of course, thank you again to the Myasthenia Gravis Foundation of Michigan for allowing me. This is an honor to speak to you and tell you more about telemedicine. Again, I am Aileen Antonio, one of the neuro-ophthalmologists over at St. Mary's in Grand Rapids.
Thank you, Dr. Antonio, for your valuable insight into how we can have our best telehealth visits with any of our doctors, but especially our neurologists and other MG specialists. If you found value in this information, please consider a donation to the Myasthenia Gravis Foundation of Michigan. Your donation helps ensure that we can continue to offer this important info to our MG family going forward. You can donate by texting MGMI to 41444 or by visiting our website, mg-mi.org. We look forward to you joining us tomorrow for Lisa Gigliotti's talk on resiliency and coraggio, beginning at noon Eastern Time.